Hey everyone, welcome to the Front Row with Ed. Today we're going to talk about shoulder pain with overhead movement. Typically what happens, people will tell me, I'm good down here, Ed, I can move my arm all the way around and I feel fine. But if I try to go overhead, I start to get some pain. Usually people will tell me, right to the side that hurts, or right up here it starts to hurt. Well, what's happening is that they're impinging the shoulder. What's impinging? Most likely it's the supraspinatus of the rotator cuff right up and through here, and also there's a bursa through here. So without getting too technical, we'll talk about some basic things that you can do that you must address. Otherwise, if you repeatedly keep going into overhead motions with a little bit of pain up and through there, that definitely can lead to a rotator cuff tear. The first exercise is called the pendulum, and you may want to have a little bit of weight. This is a can of soup, gluten-free just in case. This example is going to be my right arm that's affected. So what we want to try to do is I want you to visualize that we're creating a little bit of space between the humeral head and the top of the roof of the acromion. We're creating a little bit of space so it doesn't get pinched or impinged with overhead motion. So I'm just going to let that arm hang, let gravity kind of pull that arm down. I want you to feel a little separation through here. Shouldn't be real painful. You might just get a feeling of a stretch sensation. Then once you're here, I want you to use your body to kind of get that swinging like a pendulum. Yeah, that's why we call it a pendulum. Now we'll do it in 4 different directions. So clockwise, counterclockwise, up and down, and then we're going to go back and forth. When we go back and forth, I want you to stagger your legs a little bit. The whole idea, of course, is to keep the arm fairly limp and to use your legs to get the momentum. And I want 10 to 15 in each direction. The next concept to understand is that the shoulder lives on this rib cage. If you've ever seen me as a client, you know that I beat on this rib cage because we only go as far as our rib cage takes us. So what happens through here is that if this scapula is riding a little bit forward, that's going to bring that roof, tip it down and forward. So imagine my posture is a little bit on the slouchy side. If I've got a little tightness through my thoracic spine, and instead of being back and down here, I'm kind of forward here. What that does is it takes that roof and brings it forward. And as it brings it forward, it doesn't take as much to impinge. That's one of the tests that I'll have patients do actually, is slouch a little bit and try to lift that arm up. And oftentimes they'll get pain right away. And then I'll give them the cue that I want you to put your scapula in your back pocket. So imagine the scapula in the back pocket. So what it looks like is down and back. What that basically is doing, it's engaging the medial musculature of the scapula. So there's 2 exercises that I want you to do, and it's going to require a foam roller. So I've already done a video on that, so I'm going to put a link to it right up here. And the first one is a chest opener. So you're going to put the foam roller along through here, and you're going to open up through there to get these pecs to loosen up. The second one is going to be a foam roller across this thoracic spine, just through the upper part through here, to open up that thoracic spine to get some extension. What we're trying to do is bring the scapula into the back pocket, back and down, and get it. The last exercise is The last exercise is a simple strengthening exercise of the scapular musculature. So you're going to have to get some TheraBand here. Most gyms have it. If not, you can get it just about anywhere now. And what we're trying to do here is, if you look at me from behind, we're trying to put the scapula in the back pocket, and I want you to feel the musculature in between the shoulder blades. So what it's going to look like is you're first going to preset your scapula back and down. You're going to have your arms out in front of me, and you're going to twist your thumbs out. Good base of support. You're going to bring the band to your chest and squeeze and back slowly. Squeeze and back slowly. That's what it looks like from the front here. So scapula in the back pocket, slight bend in your knees. Arms are out here, your thumbs are pointing away. And you're going to bring it back to your chest line. You're going to squeeze those shoulder blades together. So if you do this correctly, where you should feel most of the musculature working is in between the shoulder blades. And the reason why we want to do that is because ultimately the shoulder is most reliant upon our posture. So if I am up here in better posture, I guarantee you're going to have better shoulder function. If I'm kyphotic and stiff in my thoracic spine, I'm going to come down through here. You're going to have shoulder problems with overhead motion. So even though you feel the pain here, the bigger issue is we've got to get that roof. We've got to raise the roof. We've got to get that up and out of the way so that humeral head actually has a place to go. So quickly summarize. We've got the pendulum exercise, we've got the 2 foam roller exercises to open up that thoracic spine, and then we're going to finish up here by doing a little scapular strengthening. Fingers pointed out. We're going to bring this to our chest. We're looking at about 3 sets of 10 to 15. Give that a try, see how you do. If you still have pain after you've been doing those exercises consistently with overhead motions, you may have a little bit more irritation of the bursa or the rotator cuff. But leave me a comment down below if you have any questions, and I will hopefully try to walk you through it, okay? Good luck. Tell me how you do.